So I also did not put my disclosure slide, but I am a consultant for Stryker and Smith & Nephew. So Dr. Beltran's talk leads pretty well into this, but we all know diabetes is kind of an epidemic in the U.S. It follows obesity. So right now, 8.3% of the population is diabetic. A lot of these patients, unfortunately, don't know that they're diabetic, and that's only going to double in the next 20 to 30 years. It is associated with obesity, which has also increased drastically. So as we all see from in the last 20 years, we've had a massive increase, and it's only going to get worse over time. And like he talked about, that we have obesity, and then there's severe obesity, and that's where we're really seeing problems, is that has doubled in the last 20 years, and that's just getting worse. So Memphis is actually the second fattest city in the U.S., following Jackson, Mississippi. So I see a lot of these patients, take care of a lot of these patients. This is one that I had last week, actually. So this isn't some selected case. This is just an average Memphis patient. In addition to getting bigger, we are also getting older. So the number of patients that are over the age of 65 has increased by about 20 million in the last 20 years, and it's going to increase by about another 20 million in the next 20 years or so. The more geriatric patients, or those over 85, is set to double in the next 20 years. So the complication rates of ankle fractures in general are not great. We all know that there's not much between the bone and the outside world down there. It's, especially on the lateral aspect, it's essentially skin than bone. That's made worse with these older patients with frail skin.